Let's say you have an amazing AEP. You are not seeing a dime of that until January at the earliest. I have been slaving away, writing all these new Medicare plans and stuff like that. But my wife says we got to have Christmas in December. What is a way that we could start seeing that?
All these ancillary products we're talking about today pay on issue. So what that does is it makes for a very easy process of getting that business submitted.
Yeah.
What that also means is with these policies being paying on issue, if they're getting issued on October 30th, you're probably seeing that commission hit your bank account by November 1st or 2nd.
Ladies and gentlemen, boys and girls, welcome back to the Medicare Sales Playbook. I'm your host, Dallas Keithley. We really appreciate all that you guys have done for us. You guys have been leaving comments. You guys have been talking about us. You guys have been sharing. And we really, really appreciate. Our goal is to help people grow their Medicare business one play at a time. It's hard to do that if you guys don't tell other people about us, and you've been doing that. So it's making our job just a little bit easier, making me look good. Today, we're coming to you with someone that is a great ambassador for the business of insurance. I've been doing this 23 years. And along the way, you get to meet people. I do a lot of conferences, go out and meet a lot of people and stuff like that. And this young man, from the moment I met him, the dude just lights up a room. I've never seen him negative. I've never seen him complain. I've never heard him complain. Every time I call, he picks up the phone, he answers. He's like, Dallas, I don't know if it can be done, but if it can be, we'll get it done. And so I wanted to have on just a good dude. Please welcome VP of Sales for Heartland National Life Insurance Company, Mr. Brandon Reid. Brandon, welcome to the show, man.
Hey, Dallas, thank you so much. And yes, it's been a pleasure working with you for the 7 years I've been in the industry. And I know you and I see eye to eye on a lot of different things related to this wonderful industry.
Yeah. And like I said, man, I mean, look at that smile. The dude is just always happy to be here. And maybe it's me. Maybe he just likes being around me. I don't know. I'll take all the credit. But no, he's just always happy to be here and always happy to help. I've worked with Brandon and his company for the last 7 years. 7 years. Is that how long you've been with Heartland now?
7 years, yes.
Yeah.
And, I had the privilege of plugging into one of the other greats in the industry, Nick Micheletti, our chief marketing officer, who really taught me everything I know when it comes to hospital indemnity. Mm-hmm. And we're continuing to pass the torch on. We just brought a University of Arkansas grad into the mix here, who is also learning from myself and on the road doing trainings as well on some of these great products that can help protect our beneficiaries from spending down their assets in retirement.
Yeah, good stuff, man. And guys, like I said, Heartland National, they're located there in Kansas City, Missouri, always doing a great job for their clients. And man, I've texted them on the weekends. I've texted them in the evening and they get back saying, yeah, we can do it, or, we can't, let's find another way. So I always appreciate them. Now, what I wanted to discuss today, Brandon, is the fact that a lot of people aren't doing justice by their clients whenever they're presenting an MAPD, a Medicare supplement, even under 65 business. The stuff we're going to talk about today can really help. The stuff we're going to talk about today, I own personally. It's one of the first things that I purchased when I started looking at my health insurance, stuff like that. And that is basically, we call them ancillary products, whatever you want to call them. But the hospital indemnity plan, the cancer plan, home health care, a lot of things that can be packaged. And that's what you and your team have really specialized in, correct?
It is, yeah. And we started in the Medicare space with Medicare supplement products, in the early to mid 2000s, and really have grown into an ancillary health company where we now specialize not only in health, but also wealth with some annuity products as well, but mostly focusing in on hospital indemnity, home health care, cancer, heart attack, and stroke, and critical illness.
Yeah. And so I want to kind of camp there today because a lot of our people, we're filming this during AEP, which again, thank you for being here because I know you're probably a tiny bit busy this time of year, but we're filming during AEP. And one of the first things I think of whenever I think of people out there reviewing MAPDs and reviewing all this stuff, let's say you have an amazing AEP. You go out and you write whatever is amazing for you, 100, 200, 500 new clients during AEP, you are not seeing a dime of that until January at the earliest, right? Ancillary products, I've had agents come to me and they're like, Dallas, I have been working 60 hours a week. I have been slaving away, writing all these new Medicare plans and stuff like that. But my wife says we got to have Christmas in December. What is a way that we could start seeing that? And the first thing I think of is hospital indemnity, cancer, stuff like that, because it pays you immediately, right? The agent is the one that gets to get paid while they're waiting on that MAPD money to come in.
That's right. Yeah, all these ancillary products we're talking about today pay on issue. So what's neat about most of these plans, hospital indemnity with a cancer rider, home health care, those two products are simplified issue. So what that means is we don't actually pull medical records or RX history at the time of issue. We look at that if they file a claim within the first year or two, depending on the product. So what that does is it makes for a very easy process of getting that business submitted in the door and showing active in your portal within 15 to 45 minutes in most cases.
Yeah.
What that also means is with these policies being paying on issue, if they're getting issued on October 30th, you're probably seeing that commission hit your bank account by November 1st or 2nd.
Yeah. And if you're doing your math at home, kids, that's one day between October 30th and November 1st, right? So now we talk about, that's why you as the agent, that's one reason you should write it. But the real reason you should write it, it's filling in a lot of gaps that your MAPD, your MedSup may even have. I've sold hospital indemnity plans with people on a Medicare supplement. Talk about why did, I know you guys didn't create the hospital indemnity plan, but why have you seen it catch on? Why do people on an MAPD really like this plan and what it does for the customer?
Yeah, and we have to thank our partners for that. It's not being sold unless agents are educated on this product. And the reason it's not being sold is because the clients aren't getting educated on it. So there's a reason less than 1% of Medicare Advantage beneficiaries have a hospital indemnity plan, and it's because they don't know it's available to them. If they're told when they're first turning 65 that your options are a Medicare supplement and a Medicare Advantage plan, a lot of people are going to go that Medicare Advantage route because it's a more affordable option in terms of monthly premiums. They'll get access to those dental, vision benefits, sometimes transportation over the counter, but they're left subject to a lot of the cost sharing that they wouldn't have to worry about on a Medigap policy. So I think a lot of that is due to our agents being educated on the products and educating their customers on them. If we're not educating our customers on all their options, Medicare Advantage with a hospital indemnity to help bridge the gaps between that $0 plan and those more comprehensive yet more expensive options, then we're doing our clients a disservice. So we have a way we can get your clients access to these great added benefits like dental, vision, and hearing at a low to no premium. But at the same time, we cannot forget to cover these individuals from those same Part A and B exposures that they're otherwise left exposed to without an indemnity program.
Absolutely. And so a lot of people, I'm sitting here taking for granted that everybody knows what a hospital indemnity plan is, right? If you would, let's start with the hospital indemnity. What exactly does your hospital indemnity plan cover? And I know there's a lot of add-ons and stuff like that, but let's go basic. What's that going to cover?
Basic is even pretty great. Built into this policy, we've got some neat features. First and foremost, when you're sitting with a Medicare Advantage beneficiary, whether it's your client or not, there's an opportunity to help that individual. The best time is when they're aging into Medicare. Specifically with our company, they'll have a guaranteed issue window between ages 64 and a half and 65 and a half. When you're sitting down with somebody who does not have state assistance, right, Medicaid, cost share protection already, we need to make sure they understand the ins and outs of their plan. If you need to see a primary care physician tomorrow, right, you'll pay a $0 or whatever that copay might be, $0 in many cases in network to see that primary care physician. Maybe $25, $35 depending on the plan to see that specialist in network. Again, that varies. But where our job is to come in and help protect them from a lot of the bigger exposures. And you need to use that summary of benefits as a script here. And you can do that by showing them, if you have a $295 copay days 1 through 6 in the hospital, right? A lot of people don't want to be at risk to have to pay a $295 copay for 6 days. You might be able to afford it, but a lot of people can't. And then even if you can afford it, you might not want to be paying that or subject to that in the event of an accident or illness, especially if you're in a situation where you have multiple accidents or illnesses in the same year. Those copay amounts, several hospital stays in the same year, can add up pretty quickly and take an individual to hit a maximum out of pocket that, not many people expect to have to pay.
Right. And I want to say something. I want to jump in something here real quick because you said something, and man, if I don't say it now, I'm going to forget.
Yeah.
When it comes to MAPDs, a lot of times we sell based on it's not going to cost you very much. You're not going to have a lot of, because let's be honest, we're sitting down in front of someone that doesn't have $5,000 sitting in the checking account. They don't have $10,000 sitting in the checking account. So they're attracted to the zero premium. But what we fail to think about is, okay, they don't have the money to pay for a Medicare supplement. How in the world are they going to pay for $295 a day or $350 a day for days 1 through 5 if they go to the hospital, right? So and then what we fail to do, if we don't use the summary of benefits, like you said, we're going to get that phone call later saying, hey, I just got a bill for $1,800. It might as well be $2 million. What do I do? Right. So yeah, continue on. But I want to catch it. I see a lot of agents push the cheap, but then don't think about the end of it. What happens when?
Yeah. And you have to think of it as a whole picture. A low to no premium Medicare Advantage plan with dental, with vision benefits to where you're not having to pay a separate premium for all that great coverage. But we cannot forget about exactly what you just said, that individual in a situation where they're stuck with a $2,000 bill that they can't afford to pay, or maybe multiple $1,000 bills in the same year. When we touch on that, it's important to think back to these clients on a fixed income or a fixed budget. They can probably afford a $30, $35 a month premium. What they can't afford is several $1,000s out of pocket in the event of an accident or illness. So these are very affordable policies to help bridge the gap between a Medicare Advantage plan and a Medicare supplement, to where we can still offer some coverage from some of those same Part A and B exposures, but for a fraction of what it would cost for a Plan G or Plan F. But not intertwining the two, right? This is not a Medicare supplement. This is just helping bridge the gap.
Thank you. I heard somebody say that once on an appointment. I'm like, okay, get in the car. We're going to have a talk. Like, we don't say that.
Yeah.
It's not a Medicare supplement.
Yeah.
It is still a Medicare Advantage plan. But what we're doing is, so as we're sitting there, so it covers the hospital, right? Just the basic plan covers the hospital copay. What I love about it is you can tailor make it. So if you got somebody that's $350 a day for days 1 through 6, you sell them a plan for $350 a day for days 1 through 6. So you can tailor make it. It covers the ambulance ride, which usually, down here in Southwest Missouri, we're looking at usually for an ambulance ride is $250 or so.
So built in
$200.
Yeah, built into the policy is our ER benefit. So we'll cover an emergency room trip built in for $150 per trip in the ER, no additional cost. Now you can add an ambulance rider for about $2.40 a month, and that's a no-brainer, right? It'll help with your out-of-pocket costs in the event of an ambulance ride.
See, and you caught me there. That's the Dallas basic, because I'm adding that. Now I'm going to show them, hey, look here, it costs $2.40, but I'm not asking you. We're throwing in that ambulance rider. Yeah. Because if you go to the emergency room, the number one way you usually get there, you ride in a little box with lights on it. So, and that's not cheap.
Yeah, and Dallas, you learned from Bill Ellsworth. So Bill Ellsworth always taught, let's show them an illustration here. You can do some math with your client. If you take a trip in the ambulance, where are you going? To the emergency room most of the time, right? What happens when you're done in the emergency room? They admit you to the hospital, or they send you home. In the event you do take a trip in the ambulance, visit the ER and are admitted to the hospital, here's what that bill would look like due to your copays. Yeah. And then here's what Heartland would pay you in that exact situation. And a lot of times we're making money. from having a policy like this in place, and your clients are able to use some of that leftover benefit to pay for, other bills, like maybe family members who had to pay for parking passes to visit them in the hospital, things like that.
Yeah.
So really
I always use the line, look, your emergency room is $90. You're going to make $150. There are easier ways to make $60. But if you're bored on a weekend, go ahead and clean out the gutters, because you've got that bad boy sitting there, right?
Yeah.
So so that's the basic. Now you can add on other stuff and stuff like that. Talk about some of the riders that can be added on, and maybe, why you would add those on in a certain situation.
Yeah, one of the biggest things for me, aside from adding that ambulance rider in there, is cancer. Of course, important to you as well, Dallas. We both have a family history of it. You have a personal history with it.
Yeah.
One of the situations I like to bring up for my clients, above and beyond what your Medicare Advantage plan covers, is even if you have a Medicare supplement policy, there are still costs associated with cancer that a lot of people don't think about. Things that aren't covered by insurance in general, let alone Medicare supplement, Medicare Advantage plans. I had a situation 2 years ago, a husband and wife. The gentleman had worked for a bank, and they were both insured through the bank, Blue Cross Blue Shield employer group health coverage. They were asking me to help them get on Medicare, right? Of course, they had delayed their Part B. At this time, they were ready to get on Medicare. We started their Part B the first of the next month, AARP Medicare Supplement Plan G, and a value script PDP. So we had taken care of them on a Plan G and a Part D drug plan, thinking that's pretty good coverage, right? Well-round coverage. Some of the best coverage you can get for medical and hospital costs. What a lot of agents don't think about, and consumers as well, is what about some of the things that aren't covered by Medicare? In this particular instant, it was a cancer drug that she was told she was diagnosed with cancer before her Part B started, about 15 days prior to everything going in force. She was told she'd have to take this medication to give her the best chance of survival. The medication wasn't covered by Medicare and was going to cost her $21,000 out of pocket.
Oof.
My immediate gut reaction was, hey, let's look at AstraZeneca's website, see if we can get her a discount from the manufacturer. The discount didn't work with Medicare, with federal Part D insurance.
Yep, happens all the time.
Yeah, so we didn't really have a way around that. It was, that way or the highway. So what we ended up having to do was we pulled the Part B application. We delayed it even further, pulled the Plan G, the Part D plan, and we stuck with the employer group health plan. The husband kept working another year. We got her the AstraZeneca discount because now she's back on the employer plan, and she paid nothing for the medication. But what if that cancer diagnosis came a month later and she was already on Medicare? We're out $21,000. Yes, the husband could have afforded it, but it brought tears to her eyes. And just knowing the fact that they were going to have to come out that much for a cancer drug. Yeah. It's not anything anybody expects. So that's why we offer coverage up to $75,000 on some of these plans in the event of a cancer diagnosis, to help with some of the things that Medicare doesn't cover, including, co-pays, co-insurances for chemotherapy, radiation on a Medicare Advantage plan, experimental treatment not covered by Medicare, even your supplement, for the under 65 demographic, loss of income and wages when you're going through treatment and you can no longer work, right? So we have to think about everything, travel and lodging, paying for flights to the Mayo Clinic or Cleveland Clinic, wherever you're going for treatment. We have stories we've heard from a lot of agents and their clients and their families of devastating health costs. Yeah,
good stuff, man. And what you just did, I hope agents are paying attention, because what you just did is how you sell a critical illness, cancer, hospital indemnity. You tell a story. Every person in the world believes it won't happen to me. 5 words. That's what keeps us from selling a policy. 5 words. It won't happen to me. The story that you told is powerful because it puts them in a real life situation. And everybody that we know, and we're going to talk more later about how to actually sell this stuff, On the MAPD side of it, I always tried to sell 2 times the MOOP. And I used a story. I would always tell people, look, I was diagnosed when I was 7. I started chemo in September. When they hung that bag, man, I hit my max out of pocket pretty quick. So I got my $5,000 max out of pocket. I got the bill in the mail. Well, most cancer plans, most cancer treatments go at least 6 months. So in January, when they hung my bag of chemo again, guess what I got? January, I got a new $5,000 bill. So that hit twice. So that's why I always at least try to do, if I've got a $4,000 MOOP, I'm selling an $8,000 cancer plan at least. And so stories like that really, really do sell. One other thing I love about what you guys do is this payment does not go to the hospital. It's called an indemnity plan for a reason. It goes directly to the consumer. So like you said, maybe you've already met your MOOP and you don't have to give anything to the hospital. Maybe you have a Medicare supplement. It goes directly to you, and you guys aren't checking in to say, hey, what did you use that money for? So
That's right.
Yeah.
Yeah. And you'll get a question, is it taxable? It's not taxable, right? You're using after tax dollars to pay your premiums. So it's an incredible deal. Indemnity style policies like this. Your clients will always ask you, is it kind of similar to AFLAC, right? We are the AFLAC in the senior market.
Yep. That's funny you say that, because every time I'm having trouble getting a client to grasp the concept, I'll sigh and say, it's like AFLAC. And they're like, oh, okay, I've got that. I don't want to say it, but I get it. And I'm afraid AFLAC's going to send me a royalty bill here before too long and be like, look, you sold some plans because you mentioned our name. Yeah. But no, that helps the customer realize. And, I have had clients that I have had paid out. They've used the money for bills. They've used the money for all that stuff. But like you said, a lot of them used it to let their spouse take off work so they could sit with them while they're in treatment. They've wanted to maybe go, like here in Southwest Missouri, we've got the Cancer Center of America in Tulsa. Mm-hmm. They wanted to go get a second opinion there. Unfortunately, we had a client, his prognosis was not good. And so he took his whole family to Disneyland for one last time. I've heard of people taking their family on a cruise for, just enjoying the family one more time. Money does not buy happiness, but it does give you opportunity to do something and gives you options. And I think that's why that's a big part of why we do what we do.
Yeah. It allows you to focus on the treatment, not the financial side of it.
Exactly. I always, I tell the story. My doctor asked me, Dallas, how are your finances? And that struck me. And I've said this on this podcast before, but my doctor asked me, how are your finances? And I thought that was weird. But then I realized what he was asking me was the number one reason people get down when they're going through a treatment is their finances. And when I told him about what I had, he's like, man, I wish all my clients had that. Like that would be a game changer if all of my clients had something like that. So we talked about the hospital indemnity. We talked about the cancer very briefly. You guys also offer like a home health care plan, another ancillary product. Talk about the thought behind that and maybe some of the ideas behind presenting that to your clients.
Yeah. Agents have a little bit of a harder time grasping home health care than they do hospital indemnity and cancer, because those products really do fit like a glove around Medicare Advantage plans, around Medicare in general. Where we see agents struggle a little bit is understanding where the home health care plan fits in. And a lot of times that's because if you turn to the evidence of coverage in your Medicare Advantage plan, you'll see Medicare or your Part C plan does cover 8 hours a day, up to 35 hours a week of home health care. What the client doesn't realize is that when you end up in a situation where you're needing help with activities of daily living, like bathing, toileting, getting dressed, using the restroom, toileting, maybe making the bed, doing the laundry, these types of things that a lot of our seniors struggle with after a hip replacement surgery, maybe due to arthritis over time and just crippling with age. Maybe somebody has a stroke to where not only do they need that skilled nurse to come out to the house to help them, but also maybe some therapy like physical therapy or speech therapy. Mm-hmm. Medicare is not going to cover the custodial care, the personal care side of things, the side where they're needing help with bathing. Maybe they've had a shoulder replacement and they can't wash their own hair. right? Or they've had something happen.
I'm telling you, it's weighed me down several times, man.
Yeah, and it's unfortunate.
Being able to wash my own hair, and that's the
Oh,
worst.
oh man, I'm a little
I
slow today.
apologize. Well, yeah.
Save that
Sorry.
one for the blooper.
Keep going.
Yeah.
I know. Yeah. No, you're good, buddy.
When you run into those situations where somebody needs help and they don't have a policy in place to help with those things, it's the worst thing ever. Unless they're on Medicaid, state assistance, they're not getting help with activities of daily living. So these policies not only come in and pay your clients cash for the skilled services, like that speech therapist to come in after a stroke and that skilled nurse to come out to the house. We're paying, a lot of coverage for those types of things. But at the same time, we're also paying cash benefits to your clients for help with activities of daily living. And it's affordable, compared to long-term care insurance and some of these other options out there. This is not long-term care, but this is a short-term option for you to recover from something in the comfort of your own home and the convenience of your own home, with access to your own refrigerator and food, with your pet sitting next to you on the sofa or in bed, your significant other and your family nearby, maybe your sister who lives next door. It's a game changer. You're not in an unfamiliar habitat in a cold nursing home. You're at home getting the treatment you need. And, that's a policy that pays 360 days of coverage per period of care. And if you do recover, on the home health care side, 360 days, 120 days of coverage on home health aid. And you can add an additional 60 days of home health aid coverage for $1.82 a month at 65. So you just always add that on, like the ambulance rider with hospital indemnity. Nice. That's 6 months of coverage for home health aid and almost a whole year of coverage for skilled services, home health care.
Yeah.
What your clients have to understand is if they get better, maybe after that surgery, they do recover, or after that situation, that stroke, that accident, that fall, that illness even. If they get better and they have sufficiently recovered and no longer need nursing care services or home health care services, our benefits will restore and can pay again after 180 consecutive days, after 6 months of no longer needing care, in every state right now except for Pennsylvania, where we're live. So that's really neat, because again, they'll have access to another, serious benefit down the road if they need coverage again.
Yeah, that's great stuff. And then one of my favorite things you throw on the medication reimbursement, the prescription reimbursement. And, so how much are they getting paid for generic and then versus a preferred brand?
Yeah. And this is exactly how the conversation should go. You sell them on the actual benefits, and then the cherry on top, hey, we're also going to reimburse you $15 per generic every time that generic medication is filled, and $30 on brand name drugs. So that's every time they fill their medication. If they're filling them every 30 days, we'll pay it on a monthly basis. If it's quarterly, they'll send that receipt in every quarter. And all we need to see is proof of the fill date. So they're not sending the same receipt in every week. We need to see the client's name.
That may be happening from experience, I'm guessing.
The client's name, the fill date, the name of the medication, and charges, even if the charges are zero, for that $0 copay on that tier 1 or 2 generic.
Yeah, man, you talk about cutting down the cost of the premium. There's some folks that can almost pay for it based on, what the prescriptions they're taking. So
they'll have the option between 3 levels of coverage: a basic plan for a 65-year-old at about $21 a month, a standard plan at about $43 a month premium for a 65-year-old, and a $47.57 premium for a 65-year-old on our complete plan, the most comprehensive set of benefits. If you're getting, $720 back a year, that's just 4 generics a month they're filling at $15 per generic. 4 generics a month, or 12 every quarter, right? Yeah. That is going to pay that premium for you for a 65-year-old on a complete plan. And they're actually going to walk away with a little cash in their pocket each month. And maybe they can use that to add a hospital indemnity rider and get maybe $13 off their hospital indemnity rider.
You ever thought about selling this stuff?
What's that?
I said, have you ever thought about selling this stuff, Brandon?
Yeah. That's the great thing. I do actively sell, and I ran 20 appointments this past weekend. So I'm out there, and that's what helps me stay sharp, to help our agents in the field understand these products and really work them into your portfolio.
Yeah,
book of
good
business.
stuff, man. So I kind of want to bring it all back together, right? So, because let's get applicable. I never know which word is right. Adam's going to give me the
Applicable
thumbs up
sounds
on that.
good.
Applicable works.
Let's
Applicable,
get
applicable.
applicable.
Just do it. That's all we're saying. So let's give you something that you can go with, right? So you're sitting with the client, and you said it earlier. Get that summary of benefits out for the MAPD. I'm going to give you a couple things, and then I want you, Brandon, because you're in the field now, right? So get that summary of benefits out. The way I do it is, as I'm going down through there, I'm going down through the MAPD, and I say, okay, you see here, $350 a day for days 1 through 6. Now, what I want to tell you is, remind me, I'm going to show you how you can how you can get paid and not have to pay that directly out of your pocket. Okay. So just remind me, please. And then I go down, and when I see the ER, I say that one we're also going to take care of too. Remind me to talk about that later. Then I get down to the ambulance, and I say, remind me, we're going to show you how you don't have to pay that as well. And then I also tell them, look, when you see this MOOP, this is the most important number on the page, because this is your safety net. That 4,800, that 6,200, whatever it is, that's your safety net. Be sure and make sure you understand that number. And there's 3 big ways people usually hit their MOOP. 1, they have 3 or 4 big hospital stays. 2, they have cancer. And 3, they have kidney dialysis. And I'm going to show you a way that I can take away 2 of those concerns for you, right? That's when I just sit down at the bottom of a yellow pad. That's right. I'm old school. It's still yellow pad. And I write out $350 a day is what you pay, 1 through 6. Your hospital indemnity plan pays $350 a day. So I cross that out. And then I go to the emergency room. This was this much. You actually make $60 here. The ambulance rider that we threw on pays $200 a day. Usually it's like $250. So you have to pay $50 still. Now, if you want the cancer rider, here's how much it costs and helps cover that move. Now, so which one would you like? Would you like the $30 a month plan, or would you like the $62 a month plan and just cover everything?
Yeah.
That's how I do it. I don't know if that's how you're doing it, Brandon.
Yeah,
man, you got me itching to be back in the field, dude.
Well, that's what I was going to say. The only update I would make is, back when you were selling all day, every day, it was a $90 copay in the ER. Now in 2025, we're looking at about $140 on most plans.
My goodness.
So that $150 is even more important now.
Yeah, I love how you said back in the day, we had to walk uphill to school both ways to the appointment, and yeah, exactly. We were in the house too.
Yeah.
So yeah, good stuff. Anything I'm missing there? Is there anything you would add on to that as you're talking to your client?
Yeah, that's exactly it, Dallas. I mean, of course, one of the most common ways people hit their maximum out of pockets are due to hospital stays and a cancer diagnosis. So we can cover those 2 costs for a pretty affordable premium, between $40 and $50 a month. Then it's taking it to the next level. Do we want to cover skilled nursing, surgeries, things like that? You've got options to, cover them from as much as you want there in terms of the riders that are available. So just familiarize yourself with these plans. Anytime before Dallas or myself had ever sold a policy, we would read the outline of coverage.
Yep.
Short-term home health care, hospital indemnity, a cancer plan. You have to know the ins and outs of those plans.
Be a student, man. Mm-hmm. Be a student of your business. Be a student of your craft.
And then become an educator.
Absolutely. Learn and educate. That's what we do. I want to close with this. When you do that, one thing that I've seen people do is don't sell the zero, right? If you go in and you're talking about a Medicare Advantage plan, the biggest benefit to a Medicare Advantage is there's no premium. It's 0, 0, 0, 0. And then they get down to the bottom. They say, now, if you want to do the hospital indemnity plan, it's $30. You've got them already thinking about the 0. Now, I'll tell them it's 0 premium for this portion of it. What I would do, though, it's going to run you about $45, $55, whatever dollars a month to cover everything. And, usually what I've also used the hospital indemnity plan for, and some of the skilled nursing plan for, is I get somebody that says, I really like the Advantage plan. I just hate all the risk. There's such a big risk there with that 5,000, or man, I was in New York and their max out of pockets are like 9,500 and 10,000 and 15,000. Of course, there is no hospital indemnity plan in New York. Don't sell insurance in New York. I'm sorry, New York. I love you. You got great pizza, horrible insurance plans, right? But when I'm looking at that, I say, okay, listen, this is not a med sup, right? I love the med sup because it covers everything and all that, and I have less risk. but I just can't afford it. Well, what if we could show you just kind of a medium step? Again, this is not a MedSup, but it's kind of in the middle and allows you to cover a lot of the stuff the MedSup does.
Yep. It allows us to cover a lot of those same Part A and B exposures that a Medigap policy would cover. So, thinking back to our opening statement, Dallas and I both believe we're doing our clients a disservice if we don't at least give them the option. And
Absolutely.
You really need to create some urgency at 65 when they're first getting on Medicare, or if they're retiring onto Medicare, because this isn't hospital indemnity and standalone cancer. Those are issue age rated products. When your clients buy those policies, at 65, they're paying that 65-year-old rate, and it's not going to increase as they age. When they're 70, 80, 90 years old, they're still paying that 65-year-old rate. So get it while it's affordable and while you can medically qualify for it, or in that guaranteed issue period.
Yeah. And to my first point that I made, this is great for under 65 too. I own this plan. This is a plan that I have on myself, right? Because man, like I said, I had cancer. I'm 5 years removed. So I was able to go in and answer that cancer question. Honestly, I got as much as they give me, man, because the odds of me getting it again, if you ever meet somebody, your first question is, how long has it been since you had your treatment? If it's 5 years or more, I can almost guarantee you they're going to be very interested in purchasing something that could cover them again.
That's right. Yeah. For either the cancer rider or the standalone, we look back 5 years for treatment, 5 years for cancer. And for those clients who don't want to pay a premium for additional coverage, which we run into sometimes, we have return of premium options now on the standalone cancer, heart attack, and stroke plan. So you have options you have options to get the money back in your client's hands if they don't use the policy after 20 years, or if they don't use the policy and maybe they pass away from something else, they have the option to leave it to a beneficiary like life insurance. So there's some creative things we've done on some of the newer products like that standalone cancer, heart attack, and stroke critical illness plan. And at the same time, to Dallas's point, once you've had cancer once, the chances of getting cancer again are even higher. And that's why on all our cancer plans, even the rider, we have the most aggressive schedule on our built-in restoration and recurrence benefit. Dallas knows exactly what I'm talking about.
Yep.
Gradually over the course of 5 years, that cancer benefit builds back up and can pay again. After 5 years, paying another 100% benefit out to that policyholder.
Yeah. Good stuff, guys. I know we've got real technical on this stuff today, but this is something that I believe in with all my heart, man. I've used it. I've watched my clients use it. It is probably the most used product that I ever sold because, man, I would have people when I'm doing my review, they bought an MAPD from me in 2017 or whatever. They come back in 2018. We're reviewing. I got to where I was asking them, hey, did you go to the emergency room this year? And they're like, yeah, I went to the emergency room 3 times. I'm like, dude, you have that hospital indemnity plan. I called Brandon up and he's like, get me the UB04 form from that visit and fax it in or email it, whatever. We'll get them their money. All right. And so a lot of my clients have used this and I believe it heavily. Now listen, I'm going to pull out the Baptist preacher that my dad was a Baptist preacher. So I'm going to pull this out. I already said in closing, but in real closing, think about this. When you do that, Brandon, you said you had 20 appointments this last week, correct?
Yes. Okay.
Let's say you wrote, 50%. You wrote, how many apps did you write this last week?
I don't even know, but let's say 50%.
Okay. So you wrote 10 apps. If you wrote 5 hospital indemnity plans, right?
Yeah.
At $30 a piece, average commission is what? On a $30 to $50, what are we talking?
Yeah, I would say average commission, $30 a month times 12, 9-month advance. They're going to make a couple $100 on that in a 9-month advance, $250.
Okay. Let's say $250. You sold 10 of those. That's, if I don't do math in public, but that sounds like $2,500 to me. Right. And you're not getting paid on any of the other business that you wrote until January. $2,500 doesn't suck when you can go hold a mama and say, listen, we were going to have Christmas in January. We're going to go ahead and have it in December. Because of Brandon and his team at
Oh.
Heartland National Life Insurance Company.
Because we're better protecting our clients, right? At the end
Correct.
of the day, like
That's
you said.
why.
Yeah.
But we're making mama happy too. You know what I mean?
Yeah.
So everybody's happy. It's not selfish. We're making mama and the kids happy.
Yeah.
So I love it, man. Brandon, how can they get a hold of you? What's the best way to reach out to you?
Yeah, you can reach out to anyone here. My cell phone, 913-636-8709. My email address, breid, R-E-I-D, @hnlic.com.
Brandon's giving out a cell. I don't even give you lunatics my cell phone number. like that's awesome, man. Now that's the kind of service you're going to receive. Brandon, thank you very much, guys. If you're not selling a hospital indemnity plan, reach out to these guys. Reach out. Whatever company. My goal here was not to push Heartland National, right? My goal is here to show you Brandon Reid, his love for people, his love for these products, and his love for making sure the client is fully protected. That's what I want you to get out. Heartland National does a great job with that stuff. So reach out to them. If you're not selling it, you should be. Want to say thank you to Brandon and his team for all that they do for us. Brandon, thank you very much for being on today.
Thank you, Dallas, and for the partnership as well.
Absolutely, buddy. Well, we're gonna do it for a long time more. You longer than me, as you pointed out, but still for a long time for both of us. Guys, thank you for listening to the Medicare Sales Playbook. Do me a favor, share this out there, get this stuff out. Get out there. Tell me if you go out and you write a hospital indemnity plan because of this episode. I want to hear about it. Give me some encouragement. I got a text this morning when I got out of bed, said, man, I just started listening to you. Great stuff. Thank you very much. I was like, Mom, I've been telling you about it forever, but I still appreciate the good work. No, it wasn't Mom. It was somebody else. But I was like, hey, that is encouraging. So thank you. Please keep sharing the good news with me, and we will see you next time on the Medicare Sales Playbook.